Today I'm going to talk a little bit about different disabilities or conditions that might hold some of our students back. It's important that as future educators we aware ourselves of the different conditions or disabilities that might affect our students, because disabilities in the classroom is becoming more and more of a norm in a classroom setting. My name is Zachary Dean, and today I'll be giving a presentation on other health impairments. So to begin with other health impairments, I would like to start with the IDEIA definition of other health impairments. So the IDEIA stands for the Individuals with Disabilities Education Improvement Act. And so it has to have some limited strength, alertness, a heightened alertness, and a little bit of environmental stimuli will be affected, and it results in just a limited awareness and alertness in the classroom setting. And some health problems that are considered under other health impairments would be asthma, diabetes, ADD, ADHD, just to name a few, and it also must adversely affect the child's performance in the classroom. I will be talking about two conditions specifically, which would be diabetes and epilepsy. So to start with diabetes. So diabetes is a disease in which the body doesn't produce enough insulin. And insulin is important because that's what helps break down the sugars and things we need to help us go. And the causes are unknown. Like some believe that there might be some genetic causes, while also others believe that lack of exercise and obesity can play a role in it. So characteristics: a frequency to have to use the restroom, more thirsty, a rapid weight loss without trying, dry skin, more fatigued. Then could be more sores and infections, and numb and tingling hands or feet. So learning implication. So blood sugar and learning implication has a big part when it comes to the classroom setting. It can have a negative impact on your fine motor skills in working memory and planning. So some teaching implications would be to make sure that you understand the specific needs of your child, because every child's different with diabetes and they have different needs based on their certain sugar levels. So it's important as an educator to understand what that student might need and also help them monitor and make sure they're checking their sugar, because it can have a major impact on their ability to learn. The next one is epilepsy. So epilepsy is a seizure disorder. So a seizure can be a minute to seconds. It just depends. And according to the Epilepsy Foundation of America, a seizure impacts parts or can impact all of the brain. And the causes can be varied depending on the age of the individual, but most of the time there isn't a specific known cause, even though genetics may play a small part in it. Some characteristics would be blackouts, staring, unresponsiveness, fatigue, fainting, and not being able to control their arms and legs. So learning implications, this would be a lower attention span. It would cause more trouble learning, memory issues, and cognitive weaknesses. So as teachers, we need to know what to do in situations like this, because seizures are important and are something physically going wrong in the brain, and we have to be able to know how to react if a student would go into a seizure. We also know we need to have extra assistance for these students and give them opportunity for like a student helper to help them with their notes, help them videotape classes, and just be understanding, because these students will most likely have to miss some classes due to their health issues. Also, just reduce workload on assignments and modify assignments, because it is something going on in their brain, so the memory part isn't always there. So it's important that we recognize ways we can help the students develop and help them best learn in the environment that they can. Then it's important that we realize the disabilities in students, because it's becoming more common, and other health impairments is the third leading most common disability in the classroom setting. So it's important that we, not only with other health impairments but also all disabilities, that we recognize the importance of trying to help our students and get to know them and be prepared, because it's important, because it's going to be commonly accepted in our classrooms. Thank you.